Hello, everyone. How's everyone doing today? So, I follow the YouTube channel of a friend of mine named Tennille Stewart. She has a YouTube channel that focuses largely on lupus and helping lupus patients navigate through the medical system. But there's other content too that I think is really good. One of them is a video on, plant-based diets and finding affordable food. And it touches upon SNAP cuts and other policies. Another video is about your why, defining the why in your life and even making a video on your why. And so this video that I'm doing right now is responding to my friend's video to make a video on your why. All right, so there's one issue that's been on my mind a lot lately, and it's about access to healthcare. Not everyone is able to afford healthcare. Some people go broke over it. And then now we're seeing, cuts, SNAP cuts and Medicare cuts. And, some will argue that those are necessary because those systems are not sustainable. And and some are arguing that, we need to go to single payer healthcare. I'm on the one hand, that then people wouldn't have to pay expensive fees. Others argue that that's not sustainable either, and some would argue that Americans have lifestyles that are not as healthy as countries like Japan and England and other places that have single payer. And so, just because they can afford it, well, can we afford it? Because we eat a lot worse, we exercise less, we have worse mental health. And so that's one counter argument. Now, I'm not going to argue which I think we should do. In fact, the point of this video is that, I don't want to sit and wait for a government policy, because even if single payer is right, we have to wait for it to happen. And if it never happens, then it's not going to do any good. And if it isn't sustainable, then that will be in a long-term harmful. So I want to do something now. And that's the why of this video. I want to do something now to raise money, raise awareness, to make healthcare more affordable. And so the idea I thought of was something that already exists. There are, to some degree, there's organizations like American Cancer Society, Children's Miracle Network. There's like the American Kidney Foundation, American Heart Association, St. Jude's, a lot of medical charities that raise money for various conditions. There's also Smile Train, which raises money for cleft lip reconstruction. And so those are very specific, and there's a place for specific causes. I'm glad they have it, and those are great organizations. I've donated to I probably say all of the ones that I mentioned on the list. And I did dance marathon in college to raise money for Children's Miracle Network. So those are some great organizations. So they're very specific, and I feel like there's also room for something more general. And so that's something that I'm interested in is raising funds for something more general. And I was thinking, obviously, I know I'm not going to solve the entire healthcare system, but maybe I can put a dent into it and start small and local. So maybe team up with an organization like Emory, which is in the Metro Atlanta area, where I'm at, and work with an organization that's local, and then hopefully start growing. So that's one of the ideas I had in mind to go about doing this. Now, the slight difference, rather than simply raising money for this organization, is that I wanted to do it through my business, Life Power Coaching. And there's a few reasons why I want to do it through my business. One of them is that health and wellness is, what my business is about. And, even though there's lots of causes there's lots of conditions that are not under anyone's control. Genetic diseases that people are born with, or let's just say someone gets into a car accident and has a severe injury. There's a lot of conditions that, has nothing to do with lifestyle. But then a lot of healthcare costs are lifestyle based. In fact, according to some estimates, 80% of healthcare costs are lifestyle based: diet and exercise, mental health. Now, this isn't to say it's anyone's fault if they have a heart attack or whatever, but the lifestyles we live, whether it's easy or not to live them, do affect whether we go to the hospital and thus affect the cost of medical care. And so, in addition to raising money, I also want to raise awareness for healthy living. And one of the things I already do now are lunch and learns, which I'm actually doing one Sunday, December 9th at True Food Kitchen in Buckhead at 1 p.m. So if you're watching this video before that event, you're welcome to join. And if you're watching this video after, well, I will have other lunch and learns in the future. So I want to do this as part of my business for that one reason, because it relates to health and wellness, which is a major driver of healthcare costs. Another thing is that those charities I mentioned, they're great causes. I've donated to probably about all of them, and they do phenomenal work. What's also true is that the revenue for those businesses comes through either private donations from people who have jobs, have businesses, donations from businesses, corporate sponsorships, and some of it might come through Medicare and Medicaid, which comes from tax revenue, but then that tax revenue comes from people's jobs and people's businesses. And so one way or the other, revenue to care for people does come from money from businesses and jobs, private enterprise, one way or the other. Again, I'm not trying to make this a discussion on whether we should have capitalism or socialism, but that just one way or the other, the money does come from there. And I just, my why is I just don't want to sit and wait for a policy. I want to do something now. And so those organizations raise money from one way or the other from private enterprise. And so I want to have something that's sustainable. And so I already have my fitness coaching business, and I'm brainstorming some ideas, but one of the things I had in mind was doing some form of Patreon, where you get exclusive features on my YouTube channel that you wouldn't get on the basic version, and having some of that revenue go towards whatever organization I pick, whether it be Emily or some other organization. And so some of that revenue from the Patreon goes towards helping people with healthcare costs. And so I believe to sustain such a thing, one way or the other, I want to be generating revenue and not limited to asking for donations. Not that there's anything wrong with that, but I think we need all of the above. We need nonprofits that raise money, but then we also need some form of for-profit charity, if you will, organizations that do generate revenue that help those in need. And so I want to combine this idea of premium services that some of the funds going towards healthcare costs, combine that with these public service events that I do to help people live healthy lifestyles, so they're less likely to even need the healthcare. And again, I'm not saying that everyone has total control over their lives, but on some level, some people, if I can help them live healthier lives, that's going to make them less likely to need healthcare, which not only drives costs lower for them, but also reduces costs for everyone else, some of those people being people who don't have as much control over their healthcare. And so those are some whys of why I'm interested in doing this. I just want to put a dent into the system to help make the world a better place. and so, this idea is a combination of, yes, helping people who already are experiencing health problems, but then also some level of prevention of it, and just helping people live healthy, happy lives. And so, I'd love to hear feedback from people on this idea. And this shirt I have, it's I'm not sure if you can read it. On my Pixel phone will probably is probably going to use AI to make you able to read this. But if you can't read it, it says, that's a terrible idea, what time? And so maybe this idea that I have is a terrible idea, or maybe it's a great idea. And when's the best time for it? Maybe now, maybe brainstorm a little and start in a week, whatever it may be. But hopefully this is a terrible idea that does a lot of good for this world. And I'd love to hear ideas, organizations, resources that you think might be able to get this idea to start rolling, ways to make this idea better. What are some things that you think would be worth paying extra for? Because I have a lot of free content on my channel. Would there be things like, maybe a training montage similar to Rocky or other movies? What are some things that would be interesting to be able to watch that, you would pay extra for beyond the normal videos that I have? So, thank you, everybody, and looking forward to hearing your feedback.